and welcome to Contacto, brought to you by the Houston Hispanic Chamber of Commerce. I'm Dr. Laura Murillo, President and CEO. Thank you for joining us at our Health Summit, and today we have some very special guests joining us.
This morning is have our Congressman Brady, who's always so willing to come before our Chamber of Commerce, whether it's in a large setting such as this or private one-on-one meetings where we talk about tax reform, the Ways and Means Committee, things that they are working on in energy. He's always there and at our side. So on that note, please help me welcome this morning the Honorable Congressman Brady.
Doctor, thank you so much for having me here today, and congratulations to our summit chairs, David and Juanita, for an excellent event. I love being with the Houston Hispanic Chamber of Commerce. I always like to say I had a real job before I went to Congress. I was a Chamber of Commerce executive. So I know real leadership and real talent when I meet them, and Laura, you bring this energy, this professionalism, innovation to our region, to our state every day of the week. Join me in thanking Dr. Murillo for her great work, as well as Dave and Juanita. Any chance I get to be in a room with Dr. DePinho of MD Anderson, Dr. McDevitt, I will jump on it in a second. Thank you for your leadership as well. As you know, we just last month celebrated the 50th anniversary of Medicare. It is a critical program. But we've got some challenges on it. It's a critical program not just for 50 million Americans. It's a critical program for Hispanic Americans who often enter their senior years in poorer health than other demographics, often with more likelihood for diabetes and other chronic illnesses. And no state has a greater percentage of Medicare population Hispanics than right here in Texas. So it's important that we not only strengthen and improve that program, but that we make it work for the long term. The hard truth is it's not designed for the long term. It's not designed for another 50 years. Some of it's the demographics, fewer and fewer workers, supporting more and more retirees, 10,000 retirees a day signing up for Medicare. So unless Republicans and Democrats work together, act together now to take the steps to save Medicare, we're not going to have a birthday celebration 50 years from now. The good news is we're actually taking steps, real steps, to strengthen Medicare and give it a brighter future. Earlier this year, Republicans and Democrats, you probably didn't read this, because Republicans and Democrats were working together to actually improve and take the first significant steps to save Medicare in 2 decades. And that first step of 3 steps, in my view, the first step was to find a better way to reimburse doctors so our doctors are able to see more and more seniors. This has been a looming crisis in our healthcare system, one that we couldn't tolerate, because if there's any group that needs to see a doctor they know and a doctor who knows them, it's our seniors. And so working together and working with leaders at the Texas Medical Center in Houston, we're able to accomplish that. So step 1 is done. We've still got some work to do in that area, but it really changes the way we reimburse doctors, not just on the number of procedures or the volume of procedures, but the value and the quality of health care they provide, not measured by Washington, measured by our positions here at home in our state.
KHOU 11 and the Houston Hispanic Chamber of Commerce encourage you to register and vote this November, which includes a vote for Houston's next mayor. Since 1979, voter turnout in Houston has been on the decline, with only 118,000 Houstonians voting in the last mayoral election. As the leader of Houston's new majority, the Houston Hispanic Chamber of Commerce encourages you to register, cast your ballot, and encourage others to do the same in order to make a difference in our community.
Welcome back to Contacto. I'm Dr. Laura Murillo, President and CEO of the Houston Hispanic Chamber of Commerce, and with us today is our board member, Juanita Romans. She's also serving as our co-chair of today's Health Summit. Juanita, thanks for being with us this morning.
Thank you. It's such a pleasure to be here, and it's going to be packed, and I love it. Yes.
Well, tell us, Juanita, you've been in healthcare for a very long time. Why do you think it's important for the Houston Hispanic Chamber of Commerce to be in this space?
Well, I think healthcare is a major issue today in our society. I think that it affects all the politics and businesses. And so I think that the Hispanic Chamber takes a lead in terms of educating and getting the people ready for what's coming down the pike, and also getting their feedback about what's important to them.
Well, and today joining us, we have physicians, we have dentists, doctors, insurance companies, healthcare providers, all here today at the Hilton Americas, our largest health summit to date. And our thanks to our board of directors, Juanita Romans, Dave Milich for serving as our co-chair. We'll be right back. Thank you. Welcome back to our Health Summit, and with us is Dave Milich, CEO of United Healthcare, underwriters of our Health Summit now for the last 4 years. We're so thankful to United Healthcare and to our board member, Dave Milich. Good morning.
Good morning. How are you?
Fantastic, and it looks like we're going to have a full house very soon.
Unbelievable. Unbelievable.
Well, United Healthcare has been an underwriter, very involved in this, actually brought this idea to us from Miami, and we've incorporated it, we've embraced it, and every year, Dave, we see more and more people interested in. Why do you think that is?
Well, I think, number one, healthcare is becoming a big part of the Houston economy. So I think more and more organizations are interested in what's going on in the healthcare space because it's becoming a larger and larger part of our economy. And I think the Chamber has done an excellent job of capitalizing on that and really bringing to the general public some of the ideas, the future thought processes, and innovations that are going on in the healthcare space, not only from insurers like United Healthcare, but from providers as well.
Well, and United Healthcare particularly, you all have some extraordinary initiatives. Tell us a little bit about something that's new and exciting with United Healthcare.
I think the biggest thing right now is it's all about consumer engagement. As we enter into a new era of healthcare, we're really trying to engage the consumer, the individual that purchases healthcare. We've got an exciting new model coming out where we're helping individuals make right decisions by bringing together the clinical information that we have with our member service model. So when an individual calls in and maybe they're a diabetic, we'll order them the ID card or help them with their claim, but also we'll get them engaged with a clinical professional to help them with their disease state.
Thank you. Well, on behalf of the Houston Hispanic Chamber of Commerce, we appreciate United Healthcare serving as an underwriter of this morning's Health Summit. Thank you, Dave.
Thank you.
Our next speaker who will close out the program this morning, Dr. James T. McDevitt. He is Dean of Clinical Affairs, Senior Vice President for Strategy and Growth. He is also Chief Clinical Integration Officer for CHI, St. Luke's Health. We are honored to have Dr. McDevitt, CHI, Baylor College of Medicine, as an underwriter of today's event and joining us with our keynote message. Thank you.
I'm going to talk a little bit about diabetes briefly, and that will be my call to action at the end. So I started pulling out the data. This is 1985. This is the year before I got married. I was in North Carolina, and that was sort of a fat state back then. So you can look at the numbers. 10-15% of people obese. BMI greater than 30. BMI greater than 30 means that if you're 5 foot 4 inches tall, which is not that tall, you weigh 175 pounds. That's just as an example of BMI 30. So it's pretty heavy. And why is that important? Well, obviously it's important because with that comes heart disease, kidney disease, stroke, amputations, all the sequelae of diabetes. It's a ticking time bomb. So that was 1985. So I'm going to kind of fast forward now. I've got a lot of slides, but fortunately I'm going to show every one for about a second. So 85, I guess it gets slightly worse. 87, 88, on and on and on. Oh. Yeah, that's pretty stunning, isn't it? Oh, now we have to invent a new color. It's gotten so bad that we can't use the same scale anymore. So now we've got a color greater than 20%. And now let's watch that spread. 1999 was a very bad year. I don't know what new food product came out in 1999. 2000. Oh, what is that, Mississippi? Mississippi helped us invent a new color. Again, greater than 25%, 1 in 4 people obese. And it goes on and on and on and on. This is the epidemic of our time. Thank you for your time, and I would encourage everybody to stop at our booth on the way out. Thank you.
With us today is one of our newest board members of Baylor College of Medicine, David Titus. Welcome and good morning, David.
Good morning. Glad to be here.
Well, we're happy to have you here. Baylor College of Medicine has been an integral part of this. Tell us a little bit about your role today, Baylor's role here with us, and of course CHI St. Luke's.
Well, Baylor and CHI have come together over the last year building a regional physician network, working with their 5 hospitals here. Baylor is building pods of physicians around the community to service those hospitals and deliver patient care. We're looking to also deliver a model around diabetes care here in the community, which will benefit all ethnicities, but certainly the Hispanic community. And that's why we're here to support the Health Summit.
Well, very good. Well, we give our thanks to Baylor College of Medicine and CHI. David Titus, it's great to have you on our board of directors, and we appreciate all your engagement.
I'm honored to be here. Thank you for having us. Okay.
We'll be right back. Welcome back to the Houston Hispanic Chamber of Commerce Health Summit. Joining us today is one of our underwriters, Kroger. They've been long-standing partners of our Chamber of Commerce, and with us today we have Dr. Marla Felder. Thank you so much, Doctor. Thanks for being with us.
Thank you. It's my pleasure.
Well, Kroger. People would say, well, what is Kroger doing at a health summit with the Houston Hispanic Chamber of Commerce? Tell us the role that you all play here today and why Kroger is so important to so many of our viewers.
Awesome. Well, first, our consumer affairs team is here, so they're promoting our community rewards program, where we give back $1.5 million every year to Houston businesses, and charities. And then the other reason that we're here is that our pharmacy team is here. We're providing blood pressure screenings and glucose screenings. We believe that the Hispanic customer, just like every other customer, is important to us. We really want to shout that message.
Thank you for stopping by here to visit with us. And again, thank you for underwriting today's Health Summit. We appreciate it, Doctor.
Thank you. My pleasure.
We'll be right back. Thank you. Welcome back to the Houston Hispanic Chamber of Commerce program. I'm Dr. Laura Murillo, and joining us is Lou Fragoso from Texas Children's Hospital. Lou, thank you for being with us.
Thank you for having me.
Well, this is your first time as a sponsor of this event. Why is this important to Texas Children's Hospital, Lou?
Well, you know what? It's all about healthcare in the community. The future of healthcare is in the community, and what a better example than this than being here at the Houston Hispanic Chamber of Commerce.
Tell us a little bit about some of the initiatives that Texas Children is going to be talking about today.
Well, truly, the future of healthcare is in the community, so one of the things that we're doing is expanding that access to care in the community. We've launched Texas Children's Urgent Care just last year, and part of the reason we did that is because we want families to stay in the community to receive their health care, not have to go to the emergency room. We've already seen that work. We've been able to reduce low acuity EC visits by 9% just with that. So we've saved families literally thousands of hours and dollars by being able to do that, and we plan to have 15 urgent cares by the end of 2020.
And we're finding that, as you mentioned, they want Texas Children in their community.
Absolutely, in their community.
Well, that's always great for everyone concerned. And on behalf of the Houston Hispanic Chamber of Commerce, we'd like to thank the Texas Children's Hospital for joining us today. Thank you.
Thank you so much for having me. It's a pleasure.
Thank you. We'll be right back. But now it's with great pleasure to introduce our next speaker. What a treasure it is to have MD Anderson here in our backyard, and their fearless leader of Dr. Ronald DePinho, who I've had the great pleasure of getting to know on a personal basis and understanding his vision, his passion for this city. Please welcome Dr. Ronald DePinho.
Now, I have a couple of grim statistics, but I'm going to end on a note of hope. So cancer is an enormous problem in the Latino population. It is the leading cause of death. 1 in 2 men, 1 in 3 women will be impacted by cancer. It affects every single one of us. But cancer also has its vulnerabilities, and that vulnerability is knowledge. So what I want to do this morning is just to impart you with knowledge that will allow you to give you and your family the best chances of preventing this disease in the first place or conquering it if it does occur. So cancer, first and foremost, is a highly preventable disease. Up to 50% of cancers can be prevented. Smoking, tobacco use, is an enormous problem in the Latino population here and around the world. It is a major cause of pain and suffering and accounts for 20% of all deaths and 30% of all cancer deaths. Enormously high rates, and we're working with Mexico and other countries in South America to try to impact the use of tobacco, particularly amongst youth. Most adult smokers start as children. In addition, we're working very hard to bring knowledge of opportunities to prevent diseases that are caused by viruses. And first and foremost is the human papillomavirus. 80% of the world's population is ultimately infected with HPV, which causes cervical cancer, head and neck cancer, and a variety of other cancers. About 500,000 lives lost each year around the world. Millions more suffer from the problems of this virus. This is preventable. There is a safe and effective vaccine that all 3 of my children have already received, and it's an opportunity for us to prevent these diseases from happening in the first place. Also, a major issue in the Latino population is relative inactivity, relative lack of exercise. The diet is not rich in fruits and vegetables. I was very happy to see that there's grapefruit on the tables and orange juice. It's very important to appreciate that your diet has a profound impact, not just on cancer incidence, but many other diseases as well. Also, physical inactivity is a significant issue in this population. And here, just 15 minutes of exercise per day will reduce the incidence of chronic diseases by 14%. 15 minutes. If you do more, you get even more benefit. You'll extend your life expectancy by about 3 to 5 years. This is an enormous impact. It's not a medicine, it's a lifestyle, it's a behavior. So if you exercise, eat properly, and don't smoke, you can have a major impact on your health and well-being. Also, Latinos don't engage in screening as much as they should. And catching cancer early gives you your greatest chance to survive your encounter with cancer. And so right now we have many evidence-based strategies that can detect cancers at very early stages where we can impact on the disease in a very, very effective way. Mammography, breast cancer is the leading cause of cancers in Latino women. So mammography, very important. Colon cancer is a big problem. And we also have the opportunity, if you're a smoker, to have a CT examination of your chest. We already know just that alone can reduce death by 20%, which exceeds the impact of any drug that we have available, just by catching it earlier. Also, MD Anderson is at the tip of the spear with respect to new medicines. We have the largest clinical trials engine in the world testing new drugs, and there is a revolution underway built on the bedrock of knowledge of the genome, of how the immune system works, and we're harnessing that knowledge for new drugs. And MD Anderson is responsible for leading the trials of 1 in 3 new medicines in cancer, the rest of the United States 2 and 3. So we are the main engine. We're the NASA for cancer, new cancer therapies, which are going to impact profoundly your ability to survive your encounter with cancer. Jim Allison, as an example you may have seen in the news, made seminal discoveries in understanding how the immune system works. There's now a whole new class of drugs that's reawakening the immune system, and we're seeing Lazarus results for patients with advanced disease, all of whom would have succumbed. These are game-changing advances that impact profoundly on the pain and suffering of this disease and really keep families intact. So we're all very fortunate to have MD Anderson within our environment. MD Anderson is head of the largest cancer fighting network in the world. 70% of the patients that we see are not from Houston, they're from around the world. And we also go to communities to try to impact those communities. So we have hospitals that we work with throughout the United States. We work also in other countries. We have 36 sister institutions in 24 countries. This allows us to impart our knowledge, elevate the quality of care for people who can't come to MD Anderson. We're also working very hard to exploit technology, smartphone connectivity, cloud, cognitive computing, bringing those technologies together so that we can reach the underserved throughout the United States and around the world using infinitely scalable technology. We think that is the future. MD Anderson is at the tip of the spear. We've got major partners that it's going to allow us to scale globally. So this is Houston's gift to the world. Our Texas Medical Center, the great institutions of our Texas Medical Center, are not only impacting Houston, but they're also impacting humanity. And as Houston goes, so goes the health of the globe. It's an honor to be here, and thank you for your good work.
KHOU 11 and the Houston Hispanic Chamber of Commerce encourage you to register and vote this November, which includes a vote for Houston's next mayor. Since 1979, voter turnout in Houston has been on the decline, with only 118,000 Houstonians voting in the last mayoral election. As the leader of Houston's new majority, the Houston Hispanic Chamber of Commerce encourages you to register, cast your ballot, and encourage others to do the same in order to make a difference in our community.
Hello, welcome to Contacto, brought to you by the Houston Hispanic Chamber of Commerce. I'm Laura Murillo, President and CEO. Joining us today at graduation is Nancy Salinas. Nancy Salinas is a graduate of the Emerging Leaders Institute. This is a program established by our foundation, and we're so thrilled to have her as one of the 25 young professionals graduating this evening at the Federal Reserve Bank. Nancy, thank you for joining us today.
Thank you.
Are you excited, Nancy?
I'm very excited.
It's a big day, isn't it?
Yes, it is.
Who's joining you today?
My family, my mom and my dad, and my boyfriend will be joining us.
And you work at Catholic Charities. What do you do there?
I am a development officer at Catholic Charities. I've been there since October.
And where did you go to school?
I went to school at Texas A&M University.
Okay, and left Houston and then came back to Houston.
Yes, I wanted to come back home. So.
Great. Well, so many people who are in this program have told us something that has surprised them about the program. So let's start with that. What surprised you about the Institute?
I think what really surprised me was the magnitude of the type of presenters that we had there. It was just phenomenal. It really set the tone with having our mayor, kick it off, and follow through with a lot of different people with different backgrounds that really gave us the tools and resources that we need as young professionals.
Great. So for you specifically, I know you'd said, well, I'd been in different leadership programs, so I was a bit skeptical whether or not this would really impact me. As the program's over, did you have a change of heart?
Yes. Actually, this has been a really great program for me as I am today as a young professional. I think the other programs that I've been in have molded me as I've come along, but the Emerging Leaders has really shown me, has exposed me to young professionals, and also has given me the resources and tools, like I said, to make me a better young professional here.
Wonderful. Well, we're really excited that you were in the program, and we're exceptionally thrilled that so many of you have gone on and stayed in contact with one another and are that support system. And I think that that's also a great takeaway, don't you?
It is. We've really enjoyed reconnecting after we've finished our sessions, and we plan on reconnecting throughout the future. So very excited.
Well, thank you for joining us, Nancy Salinas, one of our Emerging Leaders Institute graduates. Joining us at the Federal Reserve at our Emerging Leaders Institute graduation is Judge Ed Emmett. Welcome.
Good evening.
Always thankful for your constant engagement with our chamber, with our members, etc. I know you have a lot on your plate in the county.
We do.
What's happening that Houstonians should be aware of?
Well, we have so much, I'd have to isolate a little bit. I mean, we do everything from transportation, flood control. Lately we've had the floods. There's the Astrodome we're trying to deal with. But I think the issue that we're going to have to come to grips with more is really going to be health care. It's such a politicized topic. I've been out promoting Medicaid expansion because...
You're one of the few in your group that's doing
Yeah,
that.
I know, but the truth of the matter is, right now, property taxpayers in Harris County are footing the bill for indigent health care. And we need to find a way to provide indigent health care more efficiently. We need to be doing it through neighborhood clinics, so it's important that community leaders, particularly in the Hispanic community, get everybody to sign up, to actually participate. And we have a problem. Maybe it's a cultural problem, maybe it's not. But far too many people in the Hispanic community, particularly women, don't get checks. You know, we're seeing far too much breast cancer.
And it's all still preventative if we just
It is. Just go get checked.
Also, I know that one of the things that we've been working on with your office is trying to engage people to get them on boards and commissions and those appointments, especially these young leaders. Let people know what they need to do to serve on some of these boards.
All they need to do really is contact the county, contact my office, contact the commissioner's offices, and do it. The same's true at the city level, and same's true at the state level. You know, I'm going to be 66 years old very soon, sooner than I would like. But it's time to start turning it over to the next generation and get them involved.
Well, and that's why we're here today, celebrating these young emerging leaders. As you know, we've graduated now over 125 young leaders. We've raised for our foundation over $1.5 million. You've been at our side from day one. Thank you for all you do for Harris County. So on behalf of the Houston Hispanic Chamber of Commerce, thank you for joining us at the Emerging Leaders Institute graduation at the Federal Reserve. Hello and welcome to Contacto. Today we have very special guests from San Jacinto College. Joining us today is Jeffrey Parks. Welcome to the program.
Glad to be here. Thank you very much.
So, Jeffrey, thanks for joining us, and I know that there's many great programs at San Jacinto College, and you all are developing many phenomenal programs. You're working closely with companies and corporations to make sure you're meeting their needs. What's going on in the workforce, and what is San Jacinto College doing to prepare our workforce?
We have a lot of good programs at San Jacinto College in our petrochemical industry, and such as process technology, instrumentation, our welding programs, and those are meeting the needs of the industry because of the fact that industry is expanding right now, and with that expansion, they need workforce.
So again, those programs at San Jacinto College are really providing the needs for Houston's growing economy.
Definitely. We're meeting those needs because of the fact that as things continue to develop, we work with the industry very closely, and we're finding out what their needs are and working to meet those needs.
Very well. Second question I want to talk about a little bit more is in terms of what are you doing to help move people into these jobs? What are you doing to make sure that they move into these jobs?
Well, how we help the students get into those jobs is those industries come out and they recruit our students regularly. And we have also advisory committees where we meet with the industry, and the industry finds out about what our curriculum is, and they help us update our curriculum. So that helps meet the needs of the industry.
Very well. Well, on behalf of the Houston community and the business community in particular, thanks for all that San Jacinto College is doing to make sure that you have strong programs to meet the needs of Houston's growing economy. Thank you.
Thank you very much.
HHCC 11 and the Houston Hispanic Chamber of Commerce encourage you to register and vote this November, which includes a vote for Houston's next mayor. Since 1979, voter turnout in Houston has been on the decline, with only 118,000 Houstonians voting in the last mayoral election. As the leader of Houston's new majority, the Houston Hispanic Chamber of Commerce encourages you to register, cast your ballot, and encourage others to do the same in order to make a difference in our community.